We are here at the annual meeting of the North American Menopause Society, and I'm speaking with
Tracy Kurtzer.
And Dr. Kurtzer, you are?
I'm a physician at the Center for Sexual Medicine and Menopause at Northwestern Medicine in Chicago.
Dr. Kurtzer is somebody that is particularly knowledgeable about an area that's very uncomfortable to talk about, and that is the area of sexual trauma. In this video, we're going to talk about what a woman should do if she experiences sexual trauma. What's her options? What's her game plan?
Yeah, I mean, the most important thing is you're not alone, and you shouldn't feel like you have to deal with this alone. There's family and friends that can be a support for you, first and foremost, and we really strongly encourage you to seek medical help as well. But it really comes down to what you feel comfortable with. The process, if you come into a hospital and have had a sexual assault, is that a registered sexual assault nurse or an examiner will meet with you. You have rights around the process of having an advocate be with you so that you're not alone during the process, and everything should be very clearly explained, and a lot of support should come from the healthcare team. I know a lot of women are really hesitant to go into the hospital because they feel like it'll be impersonal or they might be blamed for what happened to them. But really, you don't need to feel that way. Things are changing, and we recognize that nobody ever deserves to have this happen to them, regardless of the circumstances. So coming in, getting that help, part of that process may be just reporting it and getting a physical exam to make sure you don't have any injuries. It may be a decision whether or not you want to proceed with a forensic examination, or what is commonly referred to as a rape kit being done, and getting that report, if you desire, to the police at that time, or making a determination if you want to hold off on that. If it might be too difficult to speak about at that point, then there's always opportunities to reach out to the police later.
Let me ask you this, just some basic things, general kind of 30,000-foot level. If it were a perfect world, who would you tell? Should you tell? How do you go about saying it? And if you go into the hospital, how do you phrase it at the front desk? What do you, who do you ask for? Just some things like that.
Yeah. I mean, I think anybody that you feel safe with in your personal life can accompany you. So that might be a friend, a parent, a sibling. And once you come into the hospital, it's just a matter of checking in. It's usually an emergency room setting, and just informing the staff there that you unfortunately just were experienced a sexual assault. They'll very promptly get you into a private room, and as quickly as possible taken care of. Ideally, during that time, not bathing or brushing your teeth is ideal. I know that can be really difficult to not want to kind of clean up afterwards, but it can interfere, unfortunately, with evidence collection if you decide to go that route. Keeping clothing that you've worn and not getting rid of it or washing it is important too. Now, if it's after the fact, a number of days or weeks later or months later, you can always talk to your gynecologist or your primary care physician.
It's never too late to say
It's
something.
never too late to come in and seek help and get resources, get testing done. So whenever you feel like you're ready to do that, we encourage as soon as possible, just so you have the option to have some evidence collection done. But it's really whenever you feel like you are ready to talk about it and get some help.
Anything else that you would like to say before closing?
Yes, absolutely. Things like this are never, ever the fault of the person who had the assault happen to them, and you should never, feel guilty or like you were responsible in any way. Just come get help and support, and you're not alone.
Thank you very much.